Okay, so we are live, and so I want to welcome everybody who is joining our live event today, our special live event. Let's do some quick introductions while people kind of get on. My name is Dr. Trent Hippard. I am a corrective chiropractor, and I am the owner and moderator of this Facebook group, Your Extraordinary Life Chiropractic. Your Extraordinary Life, West Knoxville. And today in our series, what we'll be talking about is our Health Knox series. And that Health Knox series today is titled, get my banner here, there we go, is Secrets of Blood. What is your blood work hiding? And so today's special guest that will talk about the details of that is Dr. Brooke. And before I kind of turn it over to her, let me do a few housekeeping rules. So if you're watching live or in the replay, go ahead, leave a comment, do a thumbs up, a love, whatever you'd like, just to make sure that you let us know that you're there watching. And if you're watching this live or in the replay, you have always the opportunity to leave any of your questions that you have below. Or if you're joining us here in StreamYard, you can leave your comments and we will try to answer them the best we can. And if not, we'll answer them after the live. And I'll definitely have this recorded, I think, if I didn't screw that up. But those are kind of the general concepts of what we're going to be doing. So let me kind of introduce Dr. Brooke. Dr. Brooke is a wellness doctor and also a chiropractor colleague and friend, and also just a really great human being. So her focus is in functional medicine. If I butcher anything, go ahead and just correct me after I get done here. But your love and passion happens to be what you're doing today. And I won't claim that I know exactly in detail how to describe that for you. So I just want to give the gist of that. And I'll turn it over to you, Dr. Brooke, and then you can kind of introduce anything that I left out about yourself. And then we'll kind of get started into the secrets of blood and what's hiding in your blood work. So welcome, Dr. Brooke.
Thank you. Thank you so much, Dr. Trent, for having me. It's an honor to be here with all of you. Yes, my passion is correcting blood work. So I am a functional blood work specialist. And how many of you on here today have ever been told that your labs are normal, but yet you still don't feel right, or you just know that there's something off? I hear this all the time. And one thing I want to explain to you today is there's a difference in how functional medicine practitioners read labs versus conventional medical doctors. So in conventional medicine, our normal lab value is from like the state of California to the state of Georgia. It's very broad. And in functional medicine, our optimal lab value would be like within the state of Tennessee. Mm-hmm. So for example, vitamin D in conventional medicine has a range from 30 nanograms per milliliter to 100 nanograms per milliliter. In conventional medicine, optimal is from 70 to 100. And is what I can tell you all is people don't feel well if their vitamin D levels are less than 50 nanograms. So I just want to have fun with you guys today. You can take some notes, and if you all do have some blood work that you have had done in the past, after we finish, you can go and check some things on your blood work to see if what I'm talking about is congruent with your blood work. How does that sound?
Sounds great to me. I mean, I think this would add value for any of those people. At least I know from the standpoint clinically, when I've talked to patients, most of them have had blood work done annually. And I'll pose that question right now. If you're watching this live or in the replay, go ahead, let us know below if you get your blood work done annually. And if so, just kind of leave a comment below. Yes, I do, or no, I don't. And really the idea behind all of this is most people are pretty familiar and open to the idea of having their blood work done. at least on an annual basis. Would you say that's correct?
Yes, absolutely. And I think it's important. The blood gives us a picture of what is actually happening inside our body. And is what's interesting to me, and as most of you know, the majority of people take at least one supplement. Some take 20 a day. And my question to them is, well, how do you know what supplements to take? And most of them say, oh, I read an article. Um, I saw a video on YouTube that said this was a great supplement for whatever, right?
Right.
And I'm like, well, what does your blood work show? You
Mhm.
know? So
Right.
for me, my passion is let's look at your blood work and then build a program from there to correct the blood work. And when we do that, y'all, our health goes to the next level. And so, one of the questions that we're going to discuss today are some things on my foundational lab that I use. It's called the CBC with differential. If you do see an MD or your primary care provider on a yearly basis, it's highly likely that he or she is running that lab.
Mm-hmm.
So there are 5 markers on that lab that I look at to build a foundation and to correct from there on. And those are our 5 white blood cell markers. If you all recall from biology, we learned that our white blood cells consist of neutrophils,
Mm-hmm.
lymphocytes, monocytes, eosinophils, and basophils. So when we're looking at those, let's talk about the neutrophils and lymphocytes. And I do want you all to go check your labs after this. Neutrophils fight bacteria. With that, anything above 60% is a red flag for a bacterial infection.
Okay.
Lymphocytes fight viruses. Anything above 30% is an indication of a viral infection.
Mm-hmm.
Monocytes also fight viral infections. Anything above 7% is considered a viral infection. Now, here's what's interesting. Considering what's been happening on the earth for the last few years, I can tell you that every single lab that I have read, there has been an infection present in this individual's blood work. Vaccinated, not vaccinated. So, if an infection is, and correcting an infection is the foundation, wouldn't you all want to check to see if you got that going on in your body?
I think you bring up a great point, and I want to kind of stop for 1 second so we kind of take it in. This concept, and I've been guilty of this myself, of, hey, you see the latest and greatest marketing aspect on maybe a supplement, and we don't think twice about it of, do we actually need it, versus that sounds good because maybe it hits a box and a mark of like, well, my sleep is disrupted or whatever, and so maybe I do need this. And I think the point I want to bring up here real quick to tie into what you're saying is, we want to test and not guess, right? We want to know what your body needs and not just say, hey, we're going to throw everything at it just because it sounds good. And so the reason I bring that up is because when I talk and teach about what we do in our office is looking at toxicities and deficiencies, right? And those are the 2 factors that create stress for the body, right? And so what we want to do is make sure if there is a deficiency, we're measuring that and making sure that we can add the right things to help it get back to a sufficient level. But to the toxicity level, I think that's a little bit confusing for some people, because toxicity, yes, on the extreme is you're taking too much of something that the body doesn't need, right? And so that's a key point, because if you don't need it and you don't know that from testing or having lab work done or whatever, you could be creating more toxicity or leading towards that direction. Does that help kind of add to what you're saying?
Yes, that's perfect, Trent. And beyond that is, what if you're deficient in something and you aren't aware of that? Then we need to give your body that. And so when it comes to taking the supplement, yes, we want to be taking the correct supplement to correct the blood work. And is what I can tell you all is I have corrected bacterial and viral infections, parasite infections in people's blood work, and their other markers will sometimes change. Well, Dr. Brooke, what do you mean by their other markers? I'm talking about their hormones, whether that thyroid, insulin, testosterone, estrogen, etc. So why do you think that is, y'all, from what I just spoke about? It's because you correct the foundation and then other things can start moving into place and start healing. I'm
Perfect.
not saying that we don't ever have to supplement with thyroid or correct the insulin as well. I'm just saying we correct the foundation and it's easier to correct the things up the chain.
You got it. And that's what I say is correct the core problem. Don't, address the collateral damage from the core problem, right? So lead us into some maybe common problems or misconceptions with blood work. Let's hear some of those things.
Yeah, so if y'all read the post that Trent did, one of the bullet points that he posted about was, what do you think the number one hidden cause of joint pain is? Now, whether you're on here today and you have joint pain or you don't, you probably know somebody that has joint pain. It's extremely common, especially here in America, right? So considering what we just spoke about, you guys, what do you think is the number one cause of joint pain? It's an infection, a bacterial infection. Again, going back to that neutrophil marker, anything above 60% is a red flag for a bacterial infection. So sometimes we correct that bacterial infection and the patient is like, I don't have any more joint pain. This is amazing, right? Body can function better. Okay, well, then let's talk about chronic fatigue. Another common problem nowadays, right? You can put chronic fatigue in Google and you're going to come up with a whole host of things that could potentially be causing it, correct?
Yeah.
One of the number one hidden causes of chronic fatigue is a viral infection. Again, looking at the lymphocytes or the monocytes for those viral infections. It can be one or the other. It can be both. So correct the viral infection. Make sure vitamin D levels are sufficient. Iron levels are sufficient. Boom, I've got my life back. I can function again. I wake up in the morning feeling rested and refreshed and ready to do my day and do my purpose, right?
Correct, yeah.
Yeah.
So, go ahead.
Yeah, so I think just to kind of, recap here of what would that look like if I wanted to get my blood work corrected. So number one, we correct the foundation, right? We attack the infection if there's an infection. While we're attacking the infection, we give the body support. Support as in supplements that are going to help boost our immune system. After we correct the infection, then we move into correcting the hormone markers, whatever needs left to be done of that. And after that, if the labs call for it, we will detox properly. And that is how I correct blood work.
So I have one question, and hopefully it doesn't throw you off track, but I know we're getting close to time here to kind of wrap up. But what are some common symptomatic collateral problems that most clients, patients that you work with off the top of your head that you see quite often?
Yeah, so I mean, a big one right now are women who are going through menopause, dealing with the hot flashes, dealing with the insomnia, dealing with the headaches. And the reality is those symptoms are not normal. It's not normal to go through menopause and feel those symptoms. If you are, that's your body signaling that we need to make some corrections. And in my case, I correct blood work. I had one woman, she was having 17 hot flashes a day. Wow. We've and correcting her blood work. And she now has one occasionally.
That's awesome.
I mean, it's amazing. And since we're talking about the women, let's talk about the men, right?
Mm-hmm.
We have this epidemic going on of men that have low testosterone. I'm seeing men in their 20s and 30s that have testosterone markers 200, 300. You know, they should be sitting up at 900 to 1200 with their testosterone levels at that age.
Yeah.
So that's a combination of things, right? That's a combination of the food, the toxins we're exposed to, and whatnot. But if there's an infection going on, that infection can affect testosterone,
Mm-hmm.
right? You think about what's testosterone for. It gives a man his drive.
Mm-hmm.
So those are really two big things that I've been seeing in my practice lately. I mean, I help anything from my youngest patient right now is 5 years old. My oldest patient right now is 73 years old. I work with patients that have issues with like dementia. I work with patients that have issues with their menstrual cycles, thyroid issues. I have diabetic patients where we have completely dropped their hemoglobin A1C into normal, safe levels. So, yeah, I can work with anything. We just need to correct the blood work, Dr. Trent.
Yeah. And you're great. And I'll say this, Dr. Brooke is one of our trusted colleagues that we work with patients in our office, that if there's something going on based off of, and you can kind of maybe get ready to answer this question, Dr. Brooke, how does corrective chiropractic, a non-traditional approach of what we do, and blood work kind of fit in together?
Yeah, I mean, I think one of the most powerful combinations, in all honesty. We live in a world right now where we are exposed to so many toxins and forces on a daily basis that, unfortunately, I don't think that there's just one component to a complete picture of health.
Mm-hmm.
And chiropractic is essential. Correcting the nervous system is an absolute must. Then you can supplement nutrition, correcting your blood work through supplementation, sleep, movement, all those core pieces to walk into a state of wholeness and well-being.
That's awesome. So if you're watching this live or in the replay, I want to recap, leave any of your questions you have for Dr. Brooke, or if you have anything for me, we definitely will answer them the best we can after the live. And I want to, as we wrap up here with Dr. Brooke, I want to leave her with a little bit of anything else that she wants to talk about before we kind of exit. And I will ask you, if people are interested, whether they're part of our office, they're patients or not, and they're part of our community, how do they get access to you if they're interested in seeing if you're a good fit to work with them?
Yeah, you kind of cut out on me there, Trent.
Sorry.
Yeah, I don't know that there's anything else I need to add today, Dr. Trent. I just, again, want to thank you so much for having me on and allowing me a few moments to just share what my passion and purpose is. I would just like to say that if y'all are in the Knoxville area or surrounding areas, go see Dr. Trent. He's amazing. His passion for chiropractic is like nothing I've ever seen before. And then beyond that, he just has a heart to serve people and to care for people. So get your spine checked if you haven't been in yet, and then you can move from there with your health.
So I'm going to put up your contact info. Is this the best way to get a hold of you if somebody wants to reach out and see if you can help them with their blood work and making any corrections if they need it?
Yes. Send me an email and just say where we met on this live stream, and then we will move from there.
Well, perfect. Thank you so much, Dr. Brooke, for being a part of our Health Knox series today, talking about secrets of blood and what's hiding in your blood work. I look forward to having you on again and talking about maybe some other really great topics pertaining to blood work, maybe some cases or whatever. I think that would be interesting for a lot of people. So again, thank you. Thank you, Your Extraordinary Life, West Knoxville group. If this was valuable for you, go ahead and leave us a comment below or a reaction. And if this is valuable for somebody that you know needs this information, I encourage you to invite them to our group. It's a private group, but our drive is to try to make West Knoxville the healthiest community in Tennessee. You don't have to be part of our community here in East Tennessee, but that's the great thing about Facebook groups. You can join them anywhere and learn lots of great information. So I encourage you to share this with any of your friends, family members, anybody that you love. And then always remember, when it comes to your health, you're worth it. Thank you again, Dr. Brooke, and we will talk soon.
Thank you. Bye, everyone.